So hello students, our next topic that is very important for your exam is international caries detection and assessment score. So what is ICDAS? It is a simple, logical, evidence-based system that is used for detection and classification of the dental caries. So it was developed in the year 2001 by effort of large group of the researchers. Now, what are the benefit of this ICDAS system? So what it does is it helps to focus upon the prevention of the dental caries. So it helps to focus on the prevention of the dental caries by identifying the caries lesion at an early stage. Second, it records both the enamel and dentine caries and measure the caries activity. So we have two scoring criteria. One is ICDAS 1 and ICDAS 2. So let us talk about ICDAS 1 first. So that includes the D component, that is for the caries detection. And A component. The A component is for assessment of caries process, that is whether it is cavitated, non-cavitated, arrested, or non-arrested caries. So remember here, the root caries was not included. The ICDAS 2 criteria, it was developed in the year 2009. So what includes? It includes both the coronal caries and caries that is associated with the restoration and sealants. So it includes the caries associated with the restoration and sealants along with the root caries. Now let us discuss the criteria . Let us discuss the criteria for the primary caries lesions. So criteria for coding of primary caries lesion. Score 0, it indicates no evidence of caries after prolonged air drying. So the development defects that includes enamel hypoplasia, fluorosis, teeth wear will be recorded as a sound. And the number 1 score that includes the first visual change in the enamel, that is the opacity or discoloration that is visible at the entrance to the pit and fissure after prolonged air drying, which is not hardly seen on wet surface. This question was asked in an image was given and the score was asked whether it is according to ICDAS classification, it is which type, either it is sound, initial, moderate, or advanced. So for the sound presentation, for the sound score, there will be no clinical detectable lesion. So the dentine hard tissue appears normal in color. Whereas for the initial score, there is earliest clinical detectable lesion with mild demineralization. So the mildest form are detectable only after drying. Second score is that is there is a distinct visual change in enamel. So there will be carious opacity, which is wider than the natural fissure at the entrance to the pit and fissure, where when the wet lesion must be still visible when dry. The third score is local enamel breakdown due to caries with no visible dentine or underlying shadow. And the fourth score is underlying dark shadow from the dentine, that there is localized enamel breakdown. Fifth score is distinct cavity with visible dentine. There is visual evidence of demineralization and dentine exposed with less than half of the tooth surface involved. So these are the criteria for coding for the primary carious lesion. So suppose, example, a patient comes with concern of sensitivity on drinking cold on her right lower back teeth. The clinical examination revealed presence of grayish bluish shadow on the marginal ridge of the tooth. So what would be the most appropriate coding for this lesion? So the coding will be code number 4. Similarly, caries that is associated with the restoration and sealant, the score is 0, 1, 2, 3, 4, 5, 6. The 0 score is sound, that is surface that are not restored or sealed. So remember this table for your exam point of view. So example, if a tooth that is restored with composite resin, which also exhibit extensive distinct cavity with visible dentine, so then the tooth would be coded. There will be 2-digit coding. For the composite resin, the score is 3, right? And for the distinct cavity with visible dentine, would be score as porcelain or gold or PFM crown, that is the 6. So score will be 3, 6. ICDS score for the classification of carious lesion on the root surface. So the score 0, that is ICDS 2 score criteria. So ICDS 2 code criteria. For the 0, the root surface will not exhibit any unusual discoloration that can be distinguished from the adjacent root area. The root surface has natural anatomical contour. There is loss of cementum. Abrasion are considered as code 0. Whereas the number 1, there is clearly demarked light, dark brown, black area on the root surface or cemento-enamel junction, but without cavitation. The score 2 indicates there is clearly light, dark brown, black demarcated area on the root surface with cavitation with the loss of anatomical contour that is greater than 0.5 mm. Coming to the radiographic coding system. On the radiograph, if you see no radiolucency, then the code criteria is 0. When there is radiolucency in the outer portion of enamel, then it is RA1. When there is radiolucency in the inner portion of enamel, that is the enamel dentine junction, it is RA2. When the radiolucency is limited to outer 1/3 of dentine, it is RA3. And when the radiolucency reach the middle 1/3, then it is RB4. And radiolucency reaching the inner 1/3 of dentine is RC5. RC6 radiolucency will be seen when it is seen into the pulp and there is clinically cavitated. So these are the radiographic presentation of the surface of the tooth showing criteria for the radiolucency. So in exam, there was one question. So this figure was there and it was asked that identify this figure. Was there and you have to identify the score, whether it is sound, initial, moderate or advanced. So answer was it is moderate type. So that was all about Icdas score and criteria. This question, there has been multiple questions that has been framed from this topic. So this is something important for your exam.